imagine your bone marrow as a factory, right? And its whole job is to crank out red blood cells. It does other things, but for this example, just think about your red blood cells since we're talking about sickle cell. And it makes red blood cells, and they all come out. The new baby red blood cells, the reticulocytes, come out, looking like a donut without the hole, and they're nice and round. But inside, remember we talked about those passengers inside called hemoglobin, whose job is to hold oxygen. And so, in the majority of the red blood cells with people living with sickle cell disease, inside the majority of the red blood cells are these sickle hemoglobin that have a hard time holding onto the oxygen and instead wind up holding onto each other and forming that deformed sickle shape. However, the factory produces those red blood cells as a nice round circle. The further away it gets from highly oxygenated areas like your lungs, because we're breathing in oxygen, the further away it gets from there, the more likely or the higher chance it has of sickling. And so the really interesting part here, and the thing I think we all need to remember, with the blockages that the vaso-occlusive crisis that we talked about, the pain crisis is what people typically call it, but it's actually a blockage in your blood vessel caused by those sickle cells clumping up. Those happen because round and round your sickle cells go. So they start off as a nice round circle, then they get away from oxygenated areas and they start to sickle and deform. Then they come back up to the lungs and where there's all that oxygen. They get replumped back up and turn back into another round red blood cell again, and round it goes. They go away from the oxygen areas and they sickle. Then they go back up to the oxygen areas and they plump back up. And that alone causes an intense amount of damage to the outside of the cell and damages the actual lining of your red blood cells, and which makes them sticky. And people don't realize just how important that stickiness can be. And also, every time it plumps up and sickles and plumps up and sickles, it decreases the life of the red blood cell, which is why the sickle cells only live on average between 10 and 20 days, which is so much drastically less than the 120 days that a healthy red blood cell can live. So remember today that your red blood cells do not come out already sickled if you have sickle cell disease, that the sickling actually happens later on as they are away from highly oxygenated areas, and that every single time your blood circulates, which happens once a minute, that your sickle cells have the opportunity to plump up near the oxygen areas and sickle back out as they get further away from the oxygen area. So just imagine how many times an hour, a day, a week, a month, a year that your blood cells are sickling and plumping back up. Food for thought.